A patient with the pyrexia complaining of malaise can be offered what as a first-line treatment? Option A, morphine. Option B, paracetamol. Option C, a non-steroid anti-inflammatory. Option D, cocodamol. The correct answer is option B, paracetamol. Which of the following is not a symptom of postpartum psychosis? Option A, loss of inhibition. Option B, depression. Option C, physical discomfort. Option D, hallucination. Correct answer is C, physical discomfort. Which of the following is practiced on an annual basis as a part of mandatory training? Option A, clinical governance record training. Option B, record keeping training. Option C, intravenous therapy training. Option D, basic life support training. The answer is basic life support training. Which two measurements are required to calculate a person's body mass index? Option A, weight and waist measurement. Option B, waist and chest measurement. Option C, height and weight. Option D, waist measurement and weight. The correct answer is height and weight. What does a nurse do if a terminally ill patient is unsure about using a medical device to control their pain? Option A, ask the patient to read the information of leaflet and ask if they have any questions. Option B, reassure the patient and tell them that a pharmacist will be asked to visit them. Option C, inform the patient it is a part of their treatment plan. Option D, explain the medical device to the patient and check that they fully understand. The answer is D. So as a nurse, you have to explain the patient about a medical device and you have to check whether the patient has fully understand the information that you have provided. When can a nurse disclose information that could identify a patient without gaining the patient consent? Option A, if a legal representative of the patient contacts the nurse requesting the device about their medical care. Option B, if they receive a call from someone who claims to be a relative who is worried and concerned about care of their family member. Option C, if the police telephone to request general information about someone they believe to be in the nurse's care. Option D, if other healthcare professional and agency are acting in the interest of patient safety and public protection. Answer is D. So you can only provide the information to the other healthcare professionals and agency who are working for the patient safety and public protection. A doctor refers a patient for an operation. The family do not want the operation. What positive outcome does a nurse aim for? Option A, both the family and doctor agreed that the operation will go ahead. Option B, neither the family or the doctor agrees that the operation can go ahead. Option C, the family do not agree for the operation to go ahead. Option D, the doctor say the operation goes ahead. Answer is A, both the family and doctor agree that the operation will go ahead. Nursing staff need to be aware that patients with one or more long-term conditions can develop anxiety, obesity, loneliness, and option A, sadness. Option B, depression. Option C, cheerfulness. The answer is depression. What does the nurse include in a discussion with the patient who has a BMI of 32 and has been given no advice about diet? Option A, the benefits of a healthy diet, avoiding reference to their BMI. Option B, their BMI is acceptable and they should continue with a healthy diet. Option C, their BMI is acceptable and no dietary advice needed to be given. Option D, the benefits of a healthy diet with the sensitive reference to their BMI. Answer is D. So the patient BMI is 32. It means that patient is obese and you have to provide the information regarding the benefit of the healthy diet as well as the diet which is suitable for the obese patient or the patient who is having the BMI 32. The Francis Report 2013 followed the which public inquiry into failing of an NHS Trust. Option A, the Winterbourne Inquiry. Option B, Victoria Climb Inquiry. Option C, Mid-Staffordshire Inquiry. Option D, Liverpool Community Care Inquiry. The answer is C, Mid-Staffordshire Inquiry. There have been some issue with the performance of one of the nurses in a team, including being late for work for the third time in a week. Which policy does a nurse in charge follow? Option A, sickness policy. Option B, annual leave policy. Option C, human resources policy. Option D, performance management policy. Answer is D. As nurse is having issue with the performance, so the nurse in charge has to follow the performance management policy. What does a nurse need to consider when assessing pain? Option A patient complains of being on a noisy ward and unable to sleep. Option B, the patient is on low-fat diet and complaining of indigestion. Option C, where the pain is located and does it radiate? Option D, the patient has trouble breathing and appears sinus. Answer is C. Whenever you are assessing the pain of the patient, it is important to ask the patient about where the pain is located and whether the pain is radiating or not. What technique does a nurse use when obtaining a urine sample from a female patient to minimize contamination of the specimen? Option A, dip the urinalysis into the bed pan following recent urination. Option B, clean around the urethral meters prior to a sample collection and get a midstream clean gas sample. Option C, do not clean the urethral meters as we want to analyze this bacteria as well. Option D, clean around the urethral meters prior to sample collection and collect the first portion of urine. The answer is B, clean around the urethral meters prior to a sample collection and get a midstream clean gas sample. A patient does not speak any English and booked into the clinic. No one in the department speaks this language. What action does the nurse take? Option A, cancel the patient appointment and make it for another day. Option B, continue with the patient and try to assume what they are saying. Option C, arrange for the translator to attend and provide written materials in the patient language. Option D, there is no need to speak to the patient as this is not their first appointment in the clinic and they are familiar with the procedure. The answer is C. So even though the patient does not speak in English and does not understand the English, you have to attend the patient and you have to arrange the translator and also you have to provide the information in the language that is appropriate for the patient. But in this case, as patient does not understand the English, you can provide the written material in the language that patient understands. A nurse is making a change to the legal service in their practice and they are told to follow a PDS cycle. What does this mean? Option A, Plan, Do, Study, Act. Option B, Plan, Delegate, Study, Assess. Option C, Plan, Diversify, Study, Act. Option D, Plan, Do, Stop, Assess. The correct answer is A, Plan, Do, Study, Act. In the UK, which of the following is a Class A control drug? Option A, midazolam. B, morphine. C, codeine. D, diazepam. So the answer is morphine. The line manager asks a registered nurse to administer an intramuscular injection to a patient on the unit. The registered nurse has not done this procedure for several years. How does the nurse respond? Option A, ask another nurse to do the procedure. Option B, discuss with the manager and refuse at that time. Option C, ask a student to support the procedure. Option D, give the intramuscular injection as requested. Answer is B. So as a nurse, if you don't know to do any procedure or you are confused about it or you have not practiced for several years, you have to discuss with the manager and you can refuse to do such a procedure at that time. And you have to gain a competency in the procedure to practice in the future. What nursing approach does a nurse take when working with people with a learning disability in the planning of their personal need? Option A, personal center care plan. Option B, caring intervention. Option C, nursing care plan. Option D, behavioral program. The correct answer is A, personal centered care plan. Which of the following describe the symptom of bipolar disorder? Option A, hallucination and weight changes. Option B, episode of mania and depression. Option C, fatigue and weight gain. Option D, auditory and visual hallucination. Answer is B, episode of mania and depression. How does a senior nurse ensure that staffs are current in their professional knowledge in order to provide quality care? Option A, ensure annual appraisals are completed. Option B, check the complaint logs. Option C, undertake a patient audit. Option D, check the rota for a study leave. The correct answer is C, undertake a patient audit. By the end of the shift, the nurse has not completed all their documentation ready to hand over to the next shift. What action does the nurse take? Option A, leave the documentation until the next time they are on ward, asking their colleagues to leave room for them to document. Option B, ask colleagues on the same team to complete the documentation and their name. Option C, as nothing significant has happened, there is no need to complete the rest of the documentation now. Option D, complete all documentation in a timely manner before leaving the ward. Answer is D, complete all documentation in a timely manner before leaving the ward. When a parent is in a violent relationship, why should children's social worker be contacted? Option A, so they can assess the risk to the child and act accordingly. Option B, to remove the children and place them in care. Option C, so they can communicate the information to the GP and school nursery service. Option D, so they are able to keep a record of attendance or visit to the hospital. The answer is A, so they can assess the risk to the child and act accordingly. How does a hospital nurse communicate effectively with a hospital patient who has a limited understanding of English? Option A, use the patient relative to interpret as they will understand the need of the patient and keep information confidential. Option B, ask another patient visitor who speak the same language as long as confidentiality is maintained. Option C, book a hospital interpreter, inform the patient about the role of the interpreter and maintain confidentiality and the boundaries. Option D, use a member of the hospital staff to act as an interpreter, including ancillary staff if they maintain confidentiality. Answer is C, book a hospital interpreter, inform the patient about the role of the interpreter and maintain confidentiality and boundaries. Health economics is the best described as which of the following? Option A, individual cost of a person care in the acute health system. Option B, the analysis of cost and need within the health service. Option C, a statement of how individual trusts should spend their money. Option D, how much individuals pay for their healthcare in the UK. Answer is B, the analysis of cost and need within the health service. Cheyne stokes breathing is an abnormal breathing pattern seen in which condition? Option A, pneumonia. Option B, diabetic ketoacidosis. Option C, end of life. Option D, panic attacks. Answer is end of life. Thank you for watching. Please like, subscribe and press the bell icon to get more videos.